Imagine the highways of your body, your arteries, clear and open, allowing blood to flow freely to every organ and tissue. Now picture those same highways slowly getting clogged, narrowed by roadblocks that disrupt the smooth flow of traffic. This is the essence of atherosclerosis, a gradual and often silent process where a sticky substance called plaque builds up inside your arteries. This plaque, a mixture of fat, cholesterol, calcium, and other substances found in the blood, hardens over time, making your once flexible arteries stiff and narrow. This narrowing restricts blood flow, setting the stage for serious health problems. It's like a slow-motion traffic jam happening inside your body, one that you might not even be aware of until it's too late. Understanding this process is the first step toward protecting the vital roadways that keep you alive and well. So, what causes this internal traffic jam to begin? Several key factors contribute to the development of atherosclerosis. A primary culprit is high levels of LDL, often called bad cholesterol. These particles can invade the artery wall, initiating the plaque-building process. High blood pressure, or hypertension, acts like a constant force battering the delicate inner lining of your arteries, creating damage that makes it easier for plaque to take hold. The toxic chemicals in cigarette smoke also directly harm this lining, accelerating the buildup. Furthermore, conditions like diabetes can create an environment that promotes inflammation and plaque formation. It's not just about lifestyle, though. Your genetics can predispose you to the condition, and the risk naturally increases with age, making it a multifaceted problem with deep roots in both our habits and our biology. One of the most dangerous aspects of atherosclerosis is that it often develops without any warning signs. For many years, as plaque slowly accumulates, you might feel perfectly fine. Symptoms typically only appear when an artery is so severely narrowed that the blood supply to an organ or tissue is significantly reduced. The specific symptoms depend entirely on which arteries are affected. If the arteries supplying your heart are clogged, you might experience chest pain, known as angina, or shortness of breath, especially during physical activity. If the blockage occurs in the arteries leading to your brain, it can lead to sudden numbness, weakness, or dizziness, potentially culminating in a life-threatening stroke. When atherosclerosis affects the arteries in your legs, it can cause pain when walking, a condition called claudication. In the most severe cases, a piece of plaque can rupture, forming a blood clot that completely blocks the artery, triggering a heart attack or stroke with little to no warning. Fortunately, modern medicine offers effective ways to diagnose and manage this condition. Doctors can start by assessing your risk factors through a physical exam and blood tests that measure your cholesterol levels and blood sugar. An electrocardiogram, or ECG, can detect heart rhythm problems or signs of a past heart attack. For a more detailed look, imaging tests like an ultrasound or a CT scan can visualize the plaque in your arteries. An angiogram, where a special dye is injected into your arteries, can reveal the precise location and severity of blockages. Treatment is centered on slowing the progression of the disease and preventing complications. This always begins with crucial lifestyle changes, including adopting a heart-healthy diet, getting regular exercise, and quitting smoking. Medications are also a cornerstone of therapy, used to lower bad cholesterol, control high blood pressure, and prevent blood clots. For significant blockages, medical procedures may be necessary. A stent, a tiny mesh tube, can be inserted to prop open a narrowed artery, or in more severe cases, bypass surgery may be performed to reroute blood flow around the blockage. While treatments are available, the most powerful approach to atherosclerosis is prevention. Protecting your arteries starts with the choices you make every day. A diet rich in fruits, vegetables, whole grains, and lean proteins, while being low in saturated fats and processed foods, is your first line of defense. Committing to regular physical activity, like brisk walking, swimming, or cycling, helps maintain a healthy weight, lower blood pressure, and improve cholesterol levels. Unquestionably, the single most effective preventive step you can take is to not smoke, or to quit if you currently do. Regular medical checkups are also vital to monitor your blood pressure, cholesterol, and overall cardiovascular health, allowing you to catch any potential issues early on. Taking these proactive steps empowers you to maintain control over your health and keep your body's highways clear for the long journey ahead. If you found this video helpful, please like, comment, and subscribe for more health insights. Share it with someone who might benefit.